Hello folks, my name is Dr. Zachariah Hildenbrand. I'm here with my colleague Dr. Kevin Shug, and we are the Collaborative Laboratories for Environmental Analysis and Remediation at the University of Texas at Arlington. We're coming to you from the Responsible Shale Energy Extraction Conference, which is a very unique event bringing together scientists, concerned citizens, operators, regulators, and technology companies to have an honest series of conversations about environmental stewardship in shale energy.
We'd really like to thank the support of the Cynthia and George Mitchell Foundation and Earth Day Texas for allowing us to put on this event. We believe that this content that we're going to be providing to those who haven't been able to attend is going to help answer and educate a lot of questions surrounding responsible shale energy extraction. So we hope you enjoy the content.
Hey everybody, it feels great to be back home. I grew up here in Dallas, Fort Worth, and took a little stint, maybe a decade or so, to Southern California, and I've decided to have a family, come back. Now I'm in San Antonio. And one of the reasons why I'm here is I want to talk a little bit about some of the research that I've been doing, and I'll just set the stage by saying that my background was in water quality, mostly around drinking water quality. I spent a lot of time working in rural areas in Southern California with tribal reservations looking at wellhead protection for drinking water wells. And when I moved to San Antonio and I got my tenure track job at the university, they said, "You're a water person. We've got some health concerns about water in a little community we've been working on in Pearsall, Texas, in Frio County. And they're worried about all the fracking that's going on in the community. And the Eagle Ford Shale is where it happened to be. So I will admittedly state I am a new researcher in this area. I am excited to be doing this. I am in public health. That is my background. So I specialize in community health practice. So I'm going to approach this a little bit differently and look at it from a community health perspective. And I think Anne really set the stage with some evidence out there that's strong, that's saying, hey, we need to be thinking about what's going on with production wells and how we're looking at health effects of this. And one of the most interesting things that I found working in the Eagle Ford Shale is that it's a fairly rural population. So it's a lot different than the Barnett Shale up here. And so when you have a rural population, you got a lot of interesting opinions about what's going on with oil and gas development in the area. There's some people that are very much for it, but they're also very pro-environment, and they're a bit conflicted. And so we set out to look at what's going on in the community, what are their thoughts about what's happening, and can we find any indications of what might be going on, if there is a problem, there isn't a problem, and I'm going to tell the story about that. So I'm going to deviate a little bit from my slides because I think some of this has already been covered, but you know, the basics of, we have you know, this rapid increase that we just talked about in the shale development, and it obviously has some impacts on community health. Again, my focus is on community-based participatory research. How many of you have ever heard of that? Okay, I'm not talking to my usual colleagues here. So community-based participatory research in a nutshell is involving the community at every level of research, from inception of the project to dissemination of the results and advocacy and policies around those results. And so something that I'm very interested in is that community health perspective, and how do we have transparency? Because I think that that's one of the things I've been hearing sort of threaded through these conversations today, is that we need to be open and honest. And so having that, being that we have environmental researchers, we have public health researchers, we have all these fields and disciplines coming together involving the community is actually one of the most important issues that we can have in order to make sure that what we're doing is responsible and everybody's on board with knowing what's happening. So the steps in the process has already been kind of covered today, but my point here is that each has a potential health impact. So at every single step in the process of shale energy production, there's a potential health impact. And I think Anne, again, covered some of those health impacts, but there's, you know, we have to think about, as was previously mentioned, like the boomtown effect, and how is this changing people, and how is this changing community health? We talk about all these, you know, young men coming into the community, and we have an increase in STDs, and we have high rent happening, and economic problems as a result of some of these activities. And we're not necessarily talking about that today, but in public health, that's something that we think about. It's an impact on the community that could potentially impact people's health, and it happens in every step of this process. So like we've heard already, some of those problems, air pollution, water contamination, accidents and spills, light and noise pollution, something we haven't really mentioned, but noise pollution can affect the people living in those communities and also affect the workers. So workers' health is also something that we have to take into consideration, not just the residents living in these areas, but the workers that are there, making sure that they're being protected. There actually hasn't been a whole lot of research into the health impacts on the workers. And so it's something that we need to take into consideration as well. So you have the psychosocial impacts that I kind of mentioned with the whole idea of the boomtown effect that happens sometimes, and you also have people that are worried about what's going on because they are not scientists. They don't necessarily have a clue, and they smell something bad, they think something might be wrong, and that's part of the reason why I believe firmly that transparency and communication with stakeholders at every level needs to happen. So this is, again, what are those occupational stressors? I mentioned a few already, and then those community stressors. One of the things, too, I hear a lot whenever I talk to the community members in Pearsall and Frio County, is they talk about the truck traffic. So that's part of that, steps in the process. You have a lot of rural roads out there, a lot of dust gets kicked up. A lot of people allow the companies to lease their land for roadways to go through their properties. And this actually has unintended consequences that they weren't aware of. So all of these things we like to take into account and think about when we talk about health impacts. It's not just exposure to benzene and chemicals, it's also all the other things that happen in the process. So I'm going to actually pass through that one. So we talked about ozone. I think Zach had mentioned also, the sand production, the silica that has to happen. That's something that I'm interested in learning a little bit more about because I've been looking at occupational health exposures, and that seems to be coming up in the literature as one of the main topics. Also, you have what my community that I've been working in with is this groundwater contamination. And I know that we started to talk a little bit about the water contamination potential from wells versus the flowback water and the produced water. These are all still new terms for me, so I'm still working them out. But these, what happens with the waste, basically. And all of these questions have been coming up with our community members in terms of being concerned about their well water and their water quality. So this is just sort of a list of a lot of the things that Anne covered already, so I'm just kind of putting this in a summarized format. So you have the health effects, such as just the low-hanging fruit, which is like the irritants, but then you also have the chronic exposures, like cancer and long-term health effects that could create disabilities for people as well. So these are all the potential human health concerns that I think that we need to be thinking about in terms of being more responsible. And I'll put forth a couple ideas I have about how we can help mitigate some of those health effects. So again, this exposure pathway, I want to just highlight the bottom one, which is the population, because that's sort of where I'm going with this. Because when we're talking about community health, we have to think about the community as a whole. So here in the Barnett Shale, we have a pretty large urban population that has a lot of different people of different socioeconomic status and vulnerabilities. But when I'm working in rural communities, we also have a lot of lower socioeconomic status potential and higher vulnerabilities. And we have to start thinking about, what are the cumulative impacts and who are the most vulnerable populations that we are dealing with. So any of our vulnerability studies that we do in public health, this is generally, these guys right here, and the pointer's not working, but it's all of those. Children, elderly, immunocompromised, the workers and their exposure levels, people living in poverty, isolation. And a lot of times people think, why is isolation a vulnerability issue? Well, if you live in a rural area and you don't have a good access to healthcare, I know out in some of these communities, like in Karnes County, the closest doctor or emergency room is an hour, hour and a half, 2 hours away. So it's not like you just, hey, I gotta go to the urgent care clinic and check out my asthma because I can't breathe today. So we have to worry about communities that are isolated as well. The precautionary principle. So this is something I'm hearing a little bit in this crowd. Like there's this idea, we don't want to inflict harm. We don't want to have harm or harm the environment or harm our communities and their health. But it's something that I think that if we know we're potentially exposing people to something that's a known carcinogen, how can we reduce those impacts before waiting to see if people develop cancer? And I know this theme I keep hearing is people feel like they have to prove that there's some negative health effect. Well, why do we have to have the burden on the person who's sick as opposed to having the burden on the industry and those that are the planners to help sort of mitigate some of those potential negative effects? And so I just feel really strongly that we need to think about these things. So I think in public health, we talk about prevention, and prevention can start at the industry level. So we can do this responsibly if we think about mitigating these effects. So I want to talk just a little bit about a project, and we call it the PACE project. It's Partners for a Healthy Community and Environment. And again, this started off as a community-based participatory research project with a group of individuals in Frio County, Texas, which is about an hour and a half south of San Antonio. It's on the way to Laredo. And anybody been there? Maybe some people, a few people. It's a small, Zach's been there with me quite a few times now. So basically, we started working with this group of people, and they said, hey, we've got some concerns about our health. And so my dean and another colleague of mine actually started doing a survey with them about environmental health problems that they thought might exist. And the top things that rose to the surface were air and water. And we asked them why, and they said it's all the oil and gas industry around here. We've seen a boom, and now there's a decline, and we're a little bit worried about what's been going on. So I got called in on the second half of the project, which we called PACE 2. It's very original there, but and they wanted me to further investigate the water issues that were happening. So basically, it was a mixed method study for the first one, which was qualitative interviews with focus groups, and then we also did a survey. And this was basically just to ask people, what are your top environmental concerns? These are the areas we actually surveyed for the very first one, which was Atascosa, Frio, and Karnes County. We ended up focusing just in on Frio County towards the end for the PACE 2 project, just because we wanted to hone in on a group of community members that were willing to work closely with us on this project. So this is just the basic demographics, nothing too particularly interesting about it. It actually ended up being about the same for the second part of the study. We have an interesting questions that we asked. Some of them for the first part of the study were like, have you ever worked in the oil and gas industry before? We also asked about questions, I believe, on the next survey where we talk a little bit about, do you have any knowledge about fracking? And I know that, like Zach said, there's a lot of different terms. We used fracking because that was the most common term that people there associated with unconventional oil and gas development. Interestingly enough, 86% had heard of it, but there was about 61% that said they weren't aware of any possible childhood health effects, and 52% they weren't aware of any potential adult health effects. And for me in public health, that's very interesting because one, we know that there's not a lot of available material out there about the health effects from unconventional oil and gas development. And two, it's not surprising that people haven't heard about it, but they weren't even thinking about it as a potential health effect. So a lot of people said that they were interested in understanding the environmental effects, but they weren't associating it with health effects. So at the focus groups, that's the biggest concern that came up was what's in the air that we're breathing, what's in the water that we're drinking. We're concerned about this. And so the first part of the study can kind of be summed up in the focus group. The health issues, the top concerns they had were cancer, diabetes, and they also had alcohol, substance use, and motor vehicle accidents, which I would say Any number of those could be associated with any of those steps in the process. I know it's like alcohol and substance abuse. Well, again, boomtown economy, let's talk about that a little bit more, brings in potential for things like that. And then the motor vehicle accidents is also because there's a lot of truck traffic happening. The survey health issues talked about asthma, allergies, breathing problems, and again, the same other factors were their major concerns. These are, again, the environmental issues that people were worried about: traffic, road safety, water quality, air quality, all of these, again, potentially associated with oil and gas development in the area. So the part 2 was where I came in and said, I'm gonna look at the water quality, and this is kind of where we are right now, and this is actually how I was introduced to Zach. I started reading some of his papers and said, I gotta call this guy. And I told him what we were doing, and I was actually kind of clueless as to what types of water sampling we wanted to be doing in this community. And thankfully I met Kevin and Zach, and they were helpful to partner with me in this process. And we were able to collect 78 health surveys where we asked about people's health. We asked a lot of the same questions from the first survey, and then we also asked them about their drinking water, perceptions, what they drank, how often they filtered their water, etc. And then we were able to actually collect some water samples. I apologize that my font got really small in the transition here. It was big on my screen, but it's really small here. But this is basically what I just said about the methods of the study. And the survey, you can see the demographics. I actually separated these out because this is what we're doing right now, is separating out the total surveys of 78 surveys from the 19 surveys that we collected, or 18 surveys that we collected from just the well owners. We did the same survey for everybody, and then we separated it. So most people in the community are purchasing their water. The majority of people don't drink it very often, regardless of where they're getting their water from. And they also notice some changes in the smell, taste, and appearance. And so this is something we have to analyze a little bit more, what some of their commentary was about what those changes are. But we do know that people are a little bit, I just would say, freaked out about their water. And then also the health concerns. So the most prevalent health concern was actually high blood pressure and arthritis. And there was a few other things. So we're not necessarily finding anything that sticks out in terms of cancers or other concerns like that. And then you can see Zach. Sorry, Zach, there's a couple photos of you in here. He collected the water samples, and we did the surveys. And this is the preliminary results, and this is what we're working on right now, is sort of trying to figure out what is this baseline data that we just collected. Now, and we know that the Eagle Ford Shale right now is in low production, so there's not a whole lot going on right now. So this might have been a really great time to take these results and see if we can track it over time, and that's kind of what our hope is to do, if we can continue to get funding to do it. We did find bacteria present in all but one sample, and we had some elevated TDS, some strontium in one sample, methanol, ethanol, and isopropyl alcohol in one sample. So it wasn't terribly exciting. Zach thinks it's actually more exciting than I do, but I haven't had a time to sit down and look at the results of the health survey with the water sampling yet, but we at least are getting this baseline data, and hopefully by next year we'll have some papers published about the findings. And I'm going to leave it with the research needs, because that's where I think that we are. I know that for us, we were able to get a small grant from our University of Texas Health Science Center in San Antonio to look at this. It was just a pilot study. We've gone back and asked them for potentially more funding, and they're kind of like, oh, well, we don't know if we want to continue to look at this unconventional oil and gas development issue. So it's always a constant need for the look for funding for this. And then my favorite picture of all, that's it. So, thank you.
All right, thank you, Paula. We have a lot of great questions, and unfortunately not enough time to go through them all. And I just want to remind you, I think we mentioned it earlier, for these questions that we don't get a chance to answer, we do hope to post an answer of those, at least online in a written form at a later time. We will consult with the authors of these as well. One question. How are your surveys screened to reduce bias or seeming leading of questions?
That's a very good question. I work with a great team of faculty, and we tested the survey multiple times. I work with some people that professionally develop health surveys for a living. So we vetted this across several experts, and then we also trained the survey takers. There was only 4 of us, me being one, and 2 graduate students and a research associate. And we trained them as well in how to eliminate bias. I would say it's not 100% that you completely eliminate the bias by the questions that we ask, but we did test the survey with 25 different people before we actually disseminated the survey in the community. So we hopefully removed most of the bias from those questions, hopefully. It's always a challenge in public health.
This question is kind of similar to the one that was posed to Anne, but I mean, I'd like to hear your perspective. I mean, what's the best ways to publicize the potential hazards of gas drilling, the hazards of gas drilling when people like Rick Perry present such rosy pictures of natural gas? I will read this verbatim.
You know, like Zach was saying, community town hall meetings are a really great place to just sit and talk with people. And again, I'm thinking about rural communities because this is where I'm focused, but just getting out there and talking to people, going through their like agri-life extension agents, also working with the different people that they have trust with to help kind of build that knowledge base about what's happening. Again, it isn't all rosy, we know that, but at least if we're transparent about these things, that people can have an opinion and be able to decide what they need and what they would like. And my hope is that it also creates pressure with the industry to make responsible choices as well. So open communication and dialogue, just don't hide anything, because it's always uglier if you have to try to figure things out after there's been a lot of, you know, non-discussion that's been happening and people get freaked out. That's risk communication. We do a lot of that in public health.
And then I'm compelled to ask this question just because I think it fits with the kind of message that you spent. You know, Scott Anderson mentioned all industry has risk. I mean, regarding community health concerns, does your experience allow you to suggest other industries with similar emissions or risks? And then I want to add on to that, might they have programs that, you know, in terms of considering the prevention angle, that could be emulated?
Sure, there's something that I work with a little bit with like tobacco industry as extended producer responsibility. And so that concept of extended producer responsibility means that the industry sort of takes responsibility for any of those negative effects of the production of what they do. And it's sort of that, what is it, from birth to cradle to grave, thank you. Concept of making sure that they you know, take on all of those parts of what's happening. And so I don't know if I'm answering your question, but I do think that we learn, like I said, that precautionary principle, we learned later that tobacco was so harmful. Now everybody knows the harmful effects of tobacco, and people can choose to smoke, but they also know the side effects of it. And so it's not like we had to eliminate tobacco altogether, but we had to learn to work within that realm of risk communication, and people make those choices accordingly. I'm not saying that this is similar to tobacco, but you can look at the models and lessons that have been learned from industries like that have negative implications on public health and how to work within that to make sure that that risk communication happens. Did that answer your question?
Yes, that's great. Thank
Okay.
you. All right, join me in thanking Paula one more time for their talk.